Falling to a younger person might just be a stumble, a moment of clumsiness, a quick dust-off, and life goes on. But to an elderly person, a single fall can be a turning point with no way back. It's not just a physical drop. It can be the fall of confidence, of independence, of vitality. As time passes, the human body slowly loses its balance and resilience. Muscles weaken, bones become brittle, joints grow stiff, reflexes slow down, vision fades, hearing dulls. Movements that used to be effortless, standing up, turning, walking, now require focus, effort, and care. Falls become a constant, looming threat. Whether at home, on the street, or even in the hospital, elderly individuals face this danger daily. According to the World Health Organization, tens of millions of seniors fall each year. In many countries, falls are the leading cause of injury and injury-related death among people aged 65 and above. But the reality is, most of these falls are preventable. We often think of falls as random accidents, just something that happens when you get old. But in truth, each fall is the result of many contributing factors: physical decline, medical conditions, medications, the living environment, and daily habits. Let's begin with the body. As we age, our muscles, especially those in the legs and hips, weaken. These muscle groups are critical for balance, movement, and coordination. Weak legs make walking unsteady. A stooped posture shifts the body's center of gravity forward, adds stiff joints, and a slight trip can become a dangerous fall. Our bones are more fragile with age, especially in those with osteoporosis. With low bone density, bones become porous and brittle, and more likely to break from a minor fall. A fractured hip is the most common injury in elderly falls, and among the hardest to recover from. A gentle slip while watering plants may result in 2 years of bed rest or worse, a permanent loss of mobility. On top of that are chronic illnesses that silently affect the body's balance: high blood pressure, diabetes, Parkinson's disease, vertigo, heart conditions, or post-stroke complications. These conditions can cause dizziness, muscle tremors, numb feet, fatigue, confusion, all of which greatly increase the risk of falling. Surprisingly, medications themselves can also become part of the problem. Elderly people often take multiple drugs for blood pressure, sleep, depression, or pain relief. These medications may cause drowsiness, dizziness, or sudden drops in blood pressure, especially when standing up quickly. Many falls happen in the middle of the night, right after someone wakes up and heads to the bathroom. But the cause doesn't lie only within the body. It can also be found in the place most familiar to them, their own home. Sadly, most homes, were not built with seniors in mind. Dim lighting, slippery tiles, narrow walkways, no grab bars in the bathroom, or high steps without handrails. All these are hidden traps. They are small things we overlook until it's too late. And there's the clutter. Extension cords on the floor, small furniture near the hallway, slippery rugs, old worn-out slippers for an elderly person with poor vision and slow reflexes. Even a misplaced shoe can be dangerous. We also can't ignore daily routines. Getting up too quickly from bed, walking in the dark at night without turning on the light, refusing to use a cane or walker out of pride or fear of being a burden, holding on to old, slippery footwear. All these behaviors contribute silently to the danger. And perhaps the most heartbreaking part, elderly people often hide their weakness. So they don't say when they feel dizzy. They don't mention when they almost fell. They don't ask for help until it's too late. They try to stay independent, to stay strong, and then, one day, they fall. When an elderly person falls, the first thing we often worry about is physical injury, a fractured arm, a bruised hip, or a bump on the head. But what we don't always realize is that the most devastating consequences aren't just what we can see, it's what happens afterward. Falls are the leading cause of fractures in older adults, especially hip fractures, wrist fractures, or shoulder injuries. Among them, a hip fracture is the most dangerous. Treatment often requires surgery, hip replacement, long hospital stays, and months of rehabilitation. But for seniors, recovery is difficult. A fall that takes a second to happen can lead to a permanent loss of independence. Some falls lead to head trauma, minor at first, but possibly fatal. Because the brain naturally shrinks with age, the elderly are more vulnerable to brain bleeds if they hit their head. Many older people may appear alert right after a fall, but hours later they become confused, disoriented, and sometimes slip into a coma. Without quick intervention, they may not survive. But even without visible injuries, a fall can still change everything. Many elderly individuals suffer psychological trauma after a fall. They develop a fear of walking, a fear of being alone, a fear of falling again. They lose the confidence to move freely. Someone who used to enjoy walks, gardening, and trips to the market now refuses to leave their room. They begin to rely on others for everything, even using the bathroom or getting out of bed. The longer they stay inactive, the weaker their muscles become. Blood circulation slows, lung capacity decreases, pressure sores develop, digestion is affected. They may become malnourished, constipated, or develop pneumonia. And slowly, they slip into a cycle of physical decline and emotional withdrawal. Depression often follows. They may stop speaking as much, stop smiling, stop asking for help. And when they stop believing in their ability to recover, it becomes a self-fulfilling prophecy. For the family, the impact is also heavy. One fall can turn a family's world upside down. Children take time off work. Grandchildren help with daily care. Bills pile up from hospitals, rehabilitation centers, home caregivers. Emotional fatigue sets in. There's frustration, guilt, exhaustion, even if no one says it out loud. Some families, overwhelmed by the sudden responsibility, leave the elderly person in bed for most of the day. Without movement, there's no recovery. And slowly, the person becomes bedridden, dependent on others for every need. With dignity slowly fading, in that sense, a fall is not just a physical drop. It's a long, painful unraveling. What makes it even more heartbreaking is that so many of these falls could have been prevented if only someone had taken action earlier. But we usually only react when it's already too late. An elderly man once said, quietly, in a care center, "If someone had installed a grab bar in my bathroom a bit earlier, I probably wouldn't be in this wheelchair now." A middle-aged son shared with tears, "I found my mother lying on the floor when I came home from work. She didn't fall outside. She fell in the house I built for her, but forgot to add a handrail by the stairs." These stories are far too common, and when you trace them back, it's almost always something small. A slippery mat, a dim hallway light, an old pair of shoes, or just one sudden dizzy moment after standing up. What causes serious harm in these situations isn't just the fall, it's the lack of awareness from the people around. We love our elders. We care, but sometimes we forget that a 70-year-old cannot move like a 30-year-old. A 90-year-old may be sharp in mind, but their body can still betray them when they try to get up and walk across the room. That's why fall prevention isn't just about medicine or safety gear. It's about changing our mindset as a family, as a society. It's about paying attention before something goes wrong. It's about walking in their shoes and making sure the path is safe. Because when an elderly person stays mobile, healthy, and confident, the whole family benefits. When they fall, the impact ripples through every generation. Let's not wait for the fall. Let's act now to protect, to preserve, and to give our elders the dignity they've earned over a lifetime. The good news is, even though falls are common, they are not inevitable. With the right awareness and preparation, we can prevent most falls and help seniors live safely, independently. And with confidence, it all begins with the body. physical. Strength is the foundation of balance, stability, and movement. When older adults exercise regularly, they not only build muscle, they improve coordination, posture, and reflexes, all of which protect them from falling. This doesn't mean intense workouts. Just 20 to 30 minutes a day of light, consistent activity can make a world of difference. Simple movements like walking, gentle stretching, chair exercises, or cycling on a stationary bike are all effective. Among the most important, balance training. Standing on one foot, walking in a straight line, shifting weight side to side, or basic yoga poses like tree or triangle. These small routines train the brain and body to stay steady. In many countries, seniors are encouraged to practice Tai Chi, a slow, flowing martial art that enhances balance, flexibility, and awareness of movement. Research shows that seniors who practice Tai Chi regularly reduce their fall risk by up to 40%. And beyond movement, nutrition plays a key role. A body that lacks calcium, vitamin D, or protein becomes fragile. That supports strong bones and muscles, including dairy products, leafy greens, legumes, lean protein, and healthy fats. If needed, doctors may recommend supplements like calcium tablets, vitamin D3, or protein shakes. The second strategy: managing medical conditions and medications safely. Most older adults live with at least one chronic health condition. Keeping these illnesses under control, particularly high blood pressure, diabetes, heart disease, or neurological disorders, is critical. Family members should be alert to symptoms like frequent dizziness, weakness, tremors, forgetfulness, or blurred vision, as these may indicate a higher risk of falling. Medications also deserve close attention. Many seniors take multiple prescriptions, daily blood pressure pills, sedatives, antidepressants, sleeping aids, and pain relievers. These drugs can cause drowsiness, confusion, lightheadedness, or sudden drops in blood pressure, especially when standing quickly from a bed or chair. Families should help seniors track medications, use pill organizers, and stick to exact dosages. If a senior starts acting unusually tired, slow, or groggy, consult a doctor immediately. It may be time to adjust or change the medication. The third pillar of prevention lies in modifying the home environment, especially the spaces where seniors spend the most time. A safe home starts with small, thoughtful changes. First, light. Every room, hallway, and stairwell should be well lit, both day and night. Soft, warm lighting is best, not too harsh, but bright enough to see clearly, so seniors can move safely even when it's dark. Keep walkways clear. Remove clutter, tangle-free any cords, and push furniture out of walking paths. Avoid small or loose rugs. If rugs are necessary, Use non-slip backing or double-sided tape to anchor the edges. Rugs that curl up or slide underfoot are fall traps waiting to happen. Flooring should be dry, even, and non-slippery. In kitchens, bathrooms, or anywhere water is used, choose anti-slip tiles or mats. Quickly wipe up any spills, leaks, or wet patches. If water often leaks from appliances, fix the problem immediately. The bathroom is one of the most dangerous places for falls. It needs special attention. Install sturdy grab bars near the toilet and inside the shower. Use mats or textured tiles. Provide a shower chair if standing is difficult. Consider installing emergency pull cords or buzzers near toilets in case help is needed. If the home has stairs, they must have handrails on both sides, clearly marked. Steps and reflective strips, if possible. Ideally, living spaces should be arranged to minimize the need for stairs altogether, especially if seniors are frail or have balance problems. One small detail that's often overlooked: slippers and indoor footwear seniors should wear. Non-slip shoes with firm soles that fit snugly. Avoid worn-out slippers, loose sandals, or slippery socks. Even inside the house, proper footwear is a crucial defense against falls. Beyond physical and environmental precautions, there is something just as important: the emotional and mental well-being of older adults. After a fall, what many seniors fear most isn't pain, but losing their independence. They're afraid of being seen as a burden, afraid of asking for help. So they stay silent even when they feel dizzy, even after a near fall. And that silence leads to real danger. We, the children, grandchildren, caregivers, must create a space of trust, not judgment. Encourage your elders to use assistive devices when needed: a cane, a walker, or even adult diapers if necessary. Don't make them feel embarrassed. Remind them that using tools isn't a sign of weakness. It's a choice to stay safe, strong, and in control. If possible, join them in their routines. Go for walks together. Practice stretching or gentle exercise by their side. Watch how they move, how they sit, how they get up, and quietly support them when needed. Say less, observe more, because sometimes it's not what you say, but what you notice that prevents the fall. A fall, when it happens, is never planned. It doesn't wait for a warning. It can strike anywhere: in the living room, at the top of the stairs, in the bathroom, on a sidewalk. 1 second of imbalance, one small misstep, one missing handrail, and a mother, a father, a grandparent is down. And this time, they may not get back up. And if that fall doesn't just bruise the skin, but takes away the ability to walk, the ability to stand alone, the freedom to move and live independently. Then it's not just a fall, it's a turning point. A quiet collapse of everything they once did for themselves. Because what breaks most painfully after a fall isn't just a bone. It's the spirit. It's the look in a grandmother's eyes as she watches her children bathe her. It's the sigh of a grandfather who once walked proudly, now needing help just to reach the garden. It's the soft whisper, if only, that comes too late. That is why preventing falls must become a top priority in every home, in every family. We must act before the fall, not after. Before the hospital, before the wheelchair, before the regret. That means starting now with small steps. Hold their hand when walking down the steps. Buy them new slippers with better grip. Fix the loose rug. Replace the light bulb in the hallway. Install a grab bar in the bathroom. Look at your house through their eyes. What seems safe to you may be risky to them, and listen to what they don't say. Sometimes I'm fine means I'm scared. Sometimes silence is a cry for help. More than anything, give them support without shame. Encourage them to use a cane, to accept help, to take their time. Because safety doesn't mean losing dignity. In fact, true dignity comes from feeling safe, valued, and respected, especially in old age. Fall prevention isn't just about bodies or balance. It's about love. When we make life safer for our elders, we aren't just protecting them. We are protecting memories, routines, laughter, moments, the precious small things that make up a lifetime. And when an older person stays strong and mobile, the whole family thrives. Let's stop seeing falls as just something that happens with age. Let's see them as what they truly are, signals that something needs to change. Let's shift from reaction to prevention, from regret to preparation. It takes all of us, doctors, to educate about fall risks during every visit, architects to design homes and public spaces that support aging with dignity, communities to create senior-friendly environments, and families to stay alert, stay loving, and stay involved. Let's make fall prevention a natural part of how we care for our elders, as common as checking their blood pressure, as normal as making their morning tea, as essential as telling them every day, I care. Because a single fall can take away a whole life, but one thoughtful moment, one safety adjustment, one conversation can preserve that life. Pause, then softly, with warmth, if you have aging parents. Check the floors tonight. Look at the bathroom. Check the shoes. Ask how they're feeling and really listen. If you are a senior yourself, don't be afraid to ask for help. Use support tools. Walk slowly. Speak up when something feels off. And, if you're young, take a minute to walk through your home like your grandfather would. Think like your grandmother. Because what you fix today may be the reason they stand strong tomorrow. We can't stop aging, but we can stop unnecessary pain. We can help the people we love grow old with grace and without the fear of falling. And it starts with you.